Good morning. Good morning, good morning. It's Claritha here from Jade Path. It's Tuesday, and it's time for another episode of Everyday Enlightenment. So thank you for being here, and happy fall. It's October, and it's cold here. So good morning, Elodie. Nice to see you. Nice to see you. And I did a little poll yesterday to see what you guys wanted me to talk about today. And it was the choices were acupuncture and Chinese medicine, and Reiki and energy healing, and mindfulness and meditation. And it was 50-50 between acupuncture and Chinese medicine and Reiki and energy healing. So I'm going to talk about acupuncture and Chinese medicine today, and then next Tuesday I will talk about Reiki and energy healing. So I hope that's okay with you guys. So I'm just going to give you some basics, some basic information about acupuncture and Chinese medicine. So acupuncture is a part of Chinese medicine. Chinese medicine has been around for 3,000 to 5,000 years. There's kind of a little variation in that, but it's been around a long time. And Chinese medicine has its own unique system of, its own complete system of medicine. So it has its own ways of diagnosing to figure out what is wrong with a person. And it also has its own ways of treatment to restore health and vitality to somebody. So it is its own closed system, its own complete system of assessment, diagnosis, and treatment, okay? So 3,000 to 5,000 years ago, obviously there were no x-ray machines, there were no MRIs, there were no microscopes. Sorry, there's a truck outside. So also I don't think they did autopsies at that time. So they were really observing the natural world and figuring things out with empirical data. So they developed their own ways of practicing diagnosis and deducing what is going on inside of the body when somebody got sick. So if you've ever seen a Chinese medicine practitioner, you probably know that there's a few things that they do as far as like looking at you and touching you to help give them information about what's going on. So you could kind of say we're like the body detective. We do like our own little diagnosis and follow the clues to figure out what's going on. So the first thing that you might think is different is that we look at your tongue. And that's because the tongue gives us clues about the whole body in general, about your blood circulation. And also there's a map on the tongue that talks about, or that gives us clues as to what's happening in different organ systems. Like for example, the tip of the tongue is the heart, the back of the tongue is the kidney, the sides are the liver and the gallbladder, things like that. So there's a map of the organs, but we also look at the shape of the tongue. If it's like super pointy, like think Gene Simmons from Kiss, or if it's really wide and flabby. We look at the color of the tongue, if it's really pale, if it's really red, if it's purpley, like dusky kind of color. And then we also look at the tongue coat to see if it is nice and thin or if it's really, really thick. All of those things give us different clues as to like water metabolism, energy of the body, temperature of the body, things like that. So it's sort of like one of the first places that we go to figure out the clues as to what's going on inside of your body. And then the second thing that we do is that we feel your pulse. So it is not only just for feeling the rate of the pulse, because we do that and just notice if your pulse is more slow or fast. But so there are 3 positions that we feel the pulse on each side. And it's just we feel the radial artery. So it's just above that little notch there, and then below and below. And we do this on both sides. So each position corresponds to an organ system in the body. So depending on how that position feels, gives us a clue as to what is going on in that organ system. So for example, as the pulse goes by, oh, thanks for the hearts. Hi. So as the pulse goes by, depending on what the pulse feels like, that gives us information about what's going on in that particular organ system, whether it's the heart, the liver, the kidneys, the gallbladder, the spleen, the lungs, all of that stuff. And so for example, a few different characteristics of what the pulse can feel like are, you know, one of them I use, it's my favorite is like your pulse can feel like a guitar string, so really thin and like really tight. And so that means there's a lot of tension in the area, things aren't moving as smoothly. There's probably some extra liver complications going on. So that's just one characteristic. Another characteristic that we feel often is that it can feel like wide and tight, kind of like an uncooked like fettuccine noodle, kind of like a board. That has a certain meaning for what's going on in the body. Or it can feel like a wet, overcooked spaghetti noodle, just bloop, bloop, bloop. That also means something is going on, something specific is going on in that organ or that organ system. So depending on the characteristic on each of the 6 or 12, depending on which school you practice of pulse taking, that gives us specific clues as to what's going on in that system, okay? So again, just more detective work. And then we look at the overall, we look at your overall energy. So, you know, are you walking in like this, or are you walking in like this? You know, if the skin, we look at the skin tone, like some people have, you know, everybody has like natural colorings, but like if your skin's looking a little bluish or purplish, that informs our decisions. If you're looking more green, that informs our decisions. We also take a look at the eyes. You know, that's saying the eyes are the windows of the soul. The Shen shows up in the eyes, which the Shen, S-H-E-N, is a word that we use in Chinese medicine for spirit. So it's kind of like your spirit shows up in the eyes. And so we take a look at that too. So all of that is like the tongue, the pulse, looking at you, we all plays into our assessment and diagnosis, as well as palpation. So we might palpate, which just means, you know, we'll use our fingers to touch your body. So palpation of the abdomen is really important because there are areas of hot or there are areas of cold. That's important to know. We may palpate or feel along a specific acupuncture channel. It might be dry, something like that. So all of that information feeds or all of your information that your body is giving to us before you even open your mouth. We already have a good idea of what's going on. So that's really awesome. And most practitioners are, you know, if you've studied in the States, most practitioners have had a decent amount of Western medicine training too. So obviously I want to let you guys know, like if somebody walks in and, you know, we can do orthopedic tests and neuro tests. We know how to test the cranial nerves. We know how to take blood pressure, things like that. So if somebody walks into our treatment room and it's like a red flag situation, we know how to determine that, so we can call an ambulance or send them to the ER or have them see their doc. So just want to put that out there. So I just talked about a lot of the diagnostic tools that we use for Chinese medicine. So let's move on to the types of treatments that we do. So obviously acupuncture is the most well-known treatment of Chinese medicine. And if you don't know what that is, you may have been living under a rock, but that's okay. Acupuncture is the practice of putting needles, very small needles, into specific points all over the body, because there are meridians or pathways or channels from the top of your head to the bottoms of your toes. So depending on what you need and depending on all the information that we've received from the assessment, we will determine which acupuncture points that we will be working with that day. So just to let you know, I'm going to show you guys a needle here. So if you haven't had acupuncture, hang on. If you haven't had acupuncture, here is a paper clip. Hopefully you guys can see that. And here is an acupuncture needle. So look how much bigger that paper clip is compared to that acupuncture needle. I hope you guys can see that. And they're super bendy. So, I mean, look at that. It's like a hair. It's like human hair. So really small needles. And yeah, does it help to regulate hormones? Absolutely, it can. So that is acupuncture. So cupping, and we're gonna go over 10 minutes again today. So cupping is another therapy that we use in Chinese medicine to help the musculoskeletal system. So tight muscles, achy muscles, tight tendons, things like that, where the fascia and the fascia, which is like connective tissue, can get really sticky. And so like things don't slide very well. So cupping which I just want to give a shout out to Michael Phelps, because he like made it famous. He like brought it to America. Not really, but like he brought it to the mainstream stage during the Olympics a few years ago. So cupping usually involves placing like glass or plastic or bamboo cups on the skin with suction, and so it pulls the skin in a little bit, and that helps to bring circulation. It helps to break up the stickiness and the adhesions. Maybe I should. Sometimes it does leave marks. That's the thing. But it's really good to like pull out like lactic acid and stuff that gets stuck in tissues that makes us feel sore. So there are marks that sometimes can happen, and those usually fade within a couple days, and people ask if it hurts, and it's not a painful experience. It does feel a little weird at first because we're used to having like massages where there's pressure into the tissue, whereas cupping like pulls things out. So there's like pressure out this way versus going in like a massage, okay? But it feels good. You can also do it on your face really lightly for like facial rejuvenation, but be very careful because you don't want to bruise your face. Another way to do, another therapy, another practice that falls under the Chinese medicine category is Gua Sha or Gua Sha. And this is similar to cupping. So you would use a rounded edge tool, something like this, to also treat the muscles and the tendons in the body. So yeah, so Gua Sha is great for the neck, like if you've got tight neck muscles. Again, don't do this by yourself because you do not want to needle over arteries in your neck. So just putting that out there. Go to somebody who knows anatomy. But Gua Sha is a great tool to help tight neck and like tight shoulders, especially when you feel like you're coming down with a cold. So, you know, when you feel like you're coming down with a cold and like you just start to get stiff and achy all up through here, Gua Sha is great for that. Gua Sha is also great for facial treatments to help tone and sculpt and lift. So I talked about this last week, so I won't talk about it this week, but watch my IG from last week if you're interested in that. But there's a great way to sort of like do it on the face also to kind of help lift and firm and treat the muscles underneath the skin. So two more, I'm almost done. One more practice that falls underneath the Chinese medicine category is moxibustion. And moxibustion or moxa is a heat therapy that we use in Chinese medicine. So just like you can use the acupuncture needles to treat the points along the body, you can also use heat to treat the points along the body. So we're treating the body thermally instead of with a needle. And this is really great for people who have been sick for a long time. Chemo patients love moxibustion. Fertility patients, also very helpful. Anybody who has weak digestion, I use moxa on the belly. So people who are just sort of like really deeply fatigued and need energy, moxa is a great therapy for that. And last but not least, herbal medicine. The Chinese herbal pharmacopoeia is amazing. There's formulas for absolutely everything: pain, seasonal allergies, regulating your period, can't sleep, all of that stuff. So I just ask that like don't start taking random herbs off of, if you're not an Chinese medicine herbalist, don't start taking just like grabbing things here and there like ginseng and ma huang or ephedra, because you don't know the contraindications and things like that. So go to an herbal medicine trained person. But Chinese medicine is great whether you use it by yourself or use it by itself, or you use it in combination with acupuncture, cupping, moxa, all of the other things. So that's my acupuncture and Chinese medicine talk for today. So I hope it was helpful for those of you who do not know much about acupuncture, have not had acupuncture before, or are new to all of the things that Chinese medicine can offer. So that's just the tip of the iceberg. So there's so much good stuff here. So if you have questions, please let me know. I'm happy to answer any questions about acupuncture, the therapies I talked about, the diagnostic tools that we use. Yeah, just let me know. Let me know your questions. So I hope that that was helpful. And I just want to give a shout out to other acupuncturists that are other Chinese medicine practitioners, because I know there are some people that do acupuncture that are not Chinese medicine practitioners. But this is what, if you go see a Chinese medicine practitioner, this is what is included in all of the skill set that we know and that we use. So I hope you guys have a wonderful day, have a great week, and I will see you next week talking about Reiki and energy healing Tuesday at 11:11. So see you guys later.